I am Dr. K Gireesh, physician, neurophysician and neurosurgeon, and on behalf of Padma Clinic and Nursing Home Chennai, I'll be talking to you today, that is as a part of the Health Bouquet series. There is a health awareness program for the public on Ideomotor Apraxia and where the lesion is. Ideomotor Apraxia is nothing but inability to perform a learned familiar movement to a command. You ask them to do something and they are not able to do it properly, but they might do it by themselves. The lesion usually includes in the dominant inferior parietal area and the arcuate fasciculus, which is believed to contain the spatial temporal representations of the learned skilled movements. Like cutting a paper with scissors, they will not be able to do. And the other important one is, suppose they are presented in the clinic with a toothbrush and a toothpaste, and they are told to brush the teeth. The patient, what they do is they take the tube or the toothpaste into the mouth, or try to put the toothpaste on the toothbrush without removing the cap. So such things can happen, like the toothpaste being taken into the mouth or the toothpaste being kept on the brush without removing the cap. They will try to again say do like this, or they are not able to do a sequenced act, especially on command when you ask them to do it. So that's important. That in fact exactly is the ideomotor or ideomotor apraxia, which is the inability to perform a learned familiar movement, and that too to command. You ask them to do, they will not be able to do, but sometimes by themselves they will be able to do. The lesion usually includes a dominant inferior parietal area and or the arcuate fasciculus, which is believed to contain the spatio-temporal representations of the learned skilled movements. These are in fact translated into the motor output through the mediation of the premotor cortex. So I told you actually what exactly it is. So that is in fact indeed very briefly on ideomotor or ideomotor apraxia. Thank you very much.